Call came at 6:14 in the morning. I know the exact time because I was already awake, sitting at the kitchen table with my second cup of coffee, going over the inspection checklist for batch 7 alpha. I've been doing that a lot lately, waking up before the alarm, running the numbers in my head, double-checking work I'd already checked 3 times. My wife used to say I treated our kitchen table like a second office. She wasn't wrong. The number on my phone was my direct supervisor, Philip Garrett, plant manager. 22 years at Caldwell Biopharma, the kind of guy who wore a tie even on casual Fridays and genuinely believed that quarterly bonuses were a form of personal gratitude from the company to its employees. "We need you in early," he said. "No good morning. Conference room B, 7 o'clock. I asked if everything was okay. He said, "Just be there." I drove to the plant with that checklist still sitting on the passenger seat. Caldwell Biopharma's main facility sits about 40 minutes outside Columbus, Ohio, a sprawling complex of white buildings surrounded by flat farmland that turns gold every October. I'd driven that route for 19 years. I knew every pothole, every mile marker, every exit ramp. I knew which gas station had fresh coffee before 6 a.m. and which one was selling yesterday's burnt sludge in a new pot. I'd started at Caldwell as a junior QC analyst right out of Ohio State, worked my way up through every level of the quality control department. By the time I was 44 years old, I was head of quality assurance, responsible for making sure every batch of medication that left our facility was safe, effective, and fully compliant with FDA standards. We made injectable drugs, the kind that went directly into patients' bloodstreams in hospital settings, ICUs, oncology wards, pediatric units. There is no margin for error in that work. I don't say that to sound dramatic. I say it because it's the plainest fact I know. Philip was already in conference room B when I arrived. So was Renata Osei from Human Resources, a woman I'd always liked because she was honest in a way that HR people rarely are, and sitting at the head of the table, in a chair that technically belonged to no one but had somehow become his through sheer entitlement, was the CEO's son. His name was Chadwick Moorfield III. Everyone called him Chad. He was 31 years old, had an MBA from a school I'd never heard of, and had been appointed vice president of operations 8 months ago after his father, Chadwick Moorfield Jr., our CEO, decided that fresh eyes were needed to modernize the company's operational culture. Chad's previous experience was running the marketing division of a boutique hotel chain his family partially owned in Scottsdale. He had no pharmaceutical background, no science background, no manufacturing background of any kind. What he did have was a Patagonia quarter zip that probably cost $300 and an absolutely unshakable confidence that his presence in any room was a net positive for everyone in it. I sat down. Philip wouldn't look at me. Chad leaned forward with his hands flat on the table, like he'd seen someone do that in a movie once and thought it conveyed authority. "We've been evaluating the QA department," he said, "and we feel like the function has become a bottleneck." I said, "The function exists to be a bottleneck." That's what quality control does. It stops things from moving forward until they're right. "Right," he said, in a tone that made clear he didn't think I understood what he meant. "But we're losing production time. Our competitors are moving faster. We've got a $380 million contract with Meridian Health Systems that requires batch 7 alpha to be at their distribution center by the 14th. That's 11 days from now, and you got the batch flight for extended sterility hold." "Because the initial endotoxin screen came back borderline," I said. "FDA guidance on injectables is clear. We run confirmatory testing before release. That's not a preference. That's 21 CFR Part 211. Chad nodded slowly, the way people do when they've already decided not to listen to you. "We've reviewed the data with our regulatory consultant," he said. "Which consultant?" "Dr. Ambrose Finley. He's been working with us for the past few months." I knew the name. Ambrose Finley had lost his FDA advisory panel seat 4 years ago under circumstances that were never fully explained publicly. He consulted now, mostly for companies that needed someone with official-sounding credentials to sign off on decisions that had already been made. His recommendation, Chad continued, is that the borderline reading falls within acceptable variance and that extended hold is unnecessary. I looked at Philip. He was studying a point on the wall behind my left shoulder. "I'm the head of QA," I said. "My signature goes on the batch record. My name goes on the certificate of analysis. If that product leaves this facility and something goes wrong, that's not on Dr. Finley. That's on me. That's actually what we wanted to talk to you about, Renata said quietly. She slid a folder across the table. My separation agreement was already printed, already organized with yellow sticky tabs marking where I needed to sign. They prepared it before I walked in the door. Probably before I woke up, Chad said, "We feel like your approach to quality management has become overly conservative in a way that doesn't align with where the company needs to go. We think you'd be happier in an environment that better matches your style." I sat with that for a moment. 19 years. I had spent 19 years making sure that nothing left that plant and hurt anyone. Not one FDA warning letter on my watch. Not one patient complaint linked to a product release I'd approved. I'd turned down shortcuts that would have saved the company real money, more times than I could count, because the shortcuts weren't safe. And the phrase they'd landed on was overly conservative. "Who's replacing me?" I asked. Chad straightened up. "I'll be overseeing QA directly, with support from Dr. Finley, while we conduct a search for new leadership." There it was. I signed the separation agreement, not because I agreed with any of it, but because my attorney, I had already called him from the parking lot of the gas station with fresh coffee, told me later that day I'd done the right thing. Don't fight a wrongful termination in the building where they just fired you. Fight it on your own terms, in your own time. Security walked me back to my office to collect personal items. I took my coffee mug, the framed photo of my daughter's college graduation, and a pocket-sized copy of 21 CFR Part 211 that I'd carried since my second year at Caldwell. I left everything else. On the way out through the production floor, I passed the batch staging area for 7 Alpha. I stopped. The paperwork on the stainless steel work cart was wrong. Not subtly wrong. Obviously wrong. The batch record had been amended. I could see it from 6 feet away because the amendment sticker was the wrong color. Bright orange when it should have been blue. A clerical distinction that every QA person at Caldwell knew because I'd implemented the color coding system myself 9 years ago to prevent exactly this kind of error. The orange sticker was for internal process deviations. Blue was for regulatory amendments. Someone had used the wrong one, which meant whoever filed that amendment didn't know the difference, which meant they'd been at this facility for less than a year, which meant it was someone Chad had brought in. The security officer with me was a young guy named, I noticed his badge, Jeffrey. He'd worked at Caldwell for about 2 years. Good kid. Serious about his job. "I need 30 seconds, I said. He said, "Sir, I'm supposed to..." "Jeffrey, I need 30 seconds. I walked to the cart. I didn't touch the paperwork. I didn't touch the paperwork. I just read it. Batch 7 Alpha. Release authorization signed by Ambrose Finley, Consulting Regulatory Officer. Scheduled ship date, 8 days earlier than the original contract deadline, which meant Chad had moved the timeline up on top of everything else. Destination, Meridian Health Systems Distribution Center, Indianapolis, Indiana. From there, for the Meridian contract I had personally reviewed 8 months ago, to 43 hospitals across 6 states. The sterility confirmatory test results field was blank. Not pending. Not in process. Blank. I walked out of the building. I sat in my truck in the parking lot for 4 minutes. Then I called my attorney, Scott Whitmore, and I told him exactly what I'd seen. He said, "Don't do anything yet. Let me make some calls." I said, "Scott, I know exactly what happens when a contaminated injectable batch gets distributed to 43 hospitals. I've read every incident report for every pharmaceutical recall in the last 20 years. I know what the outcomes look like." He was quiet for a moment. Then he said, "Give me 1 hour." I gave him 40 minutes. Then I called the FDA's MedWatch program directly, not the tip line. I had a direct contact at the Center for Drug Evaluation and Research from a compliance conference 3 years ago. A woman named Dr. Isabel Park, who had handed me her card and said with complete sincerity that people like me were the reason the system worked. I hadn't used the number since. I used it now. She picked up on the second ring. I told her what I'd seen. Batch number, facility, ship date, destination, the blank confirmatory test field. I told her about Dr. Finley and the pre-prepared separation agreement and the color-coded sticker that was wrong. She said, "Don't go anywhere." That was a Thursday. Friday morning at 7:42 a.m., 2 FDA investigators arrived at the Caldwell Biopharma facility in an unmarked government vehicle. I know the time because I was in the Cracker Barrel parking lot 2 miles down the road, eating eggs and waiting for Scott to call me when he sent me a text message with a single word, "Done." I later learned, through the regulatory proceedings that followed, the sequence of events inside the plant that morning. Chad had been notified of the FDA inspection request and had, apparently, attempted to reach Dr. Finley for guidance. Dr. Finley did not answer his phone. The investigators presented their credentials at the front desk, requested immediate access to the batch records for 7-alpha, and were legally required to be given that access within the hour. Chad called his father. His father called the company's outside counsel, a firm in downtown Columbus that specialized in corporate litigation, not pharmaceutical regulatory law. That distinction mattered. The investigators found the blank confirmatory test field within 11 minutes of accessing the batch records. They placed a regulatory hold on batch 7-alpha before 9 a.m. Then they requested the batch records for every release in the prior 90 days. I won't detail everything they found in that review because the formal FDA warning letter is a public document and anyone with internet access can read it. What I will say is that in the 8 months since Chad had begun his role as VP of Operations, and particularly in the 6 months since he'd begun quietly dismantling the QA oversight structure I'd spent years building, the documentation practices at that facility had degraded in ways that took investigators less than 3 hours to identify. Batch 7-alpha never left the facility. Neither did 4 other batches that were subsequently placed on hold. Meridian Health Systems canceled the contract. The $380 million deal was gone before the weekend. 3 board members called for an emergency session. 2 of them had been on the board since before Chadwick Moorfield Jr. took over as CEO, and they had never been comfortable with the nepotism, but they'd gone along with it the way people go along with things when the CEO also controls the largest voting block of shares. They stopped going along with it. I was in Scott's office on Monday afternoon when his phone rang. He looked at the screen, raised his eyebrows, and said, "Caldwell's General Counsel." The call lasted 16 minutes. I sat across from Scott and watched him take notes on a yellow legal pad. At one point, he actually put down his pen, rubbed his face with both hands, and picked the pen back up. When he hung up, he said, "They want you back." I said, "I know." "They're prepared to discuss terms, reinstatement, back pay, full benefits, written acknowledgement that the separation was without cause." He paused. "They're also proposing a consulting arrangement above your previous compensation to support the remediation process." I looked out his window at the Columbus skyline. It was a gray afternoon in late October, the kind of day where the light disappears early and everything looks like it's made of the same flat color. "What about Finley?" I said. "His consulting agreement with Caldwell has been terminated. He's also received a formal inquiry from the Ohio State Board of Pharmacy." "Chad?" Scott cleared his throat. "VP of Operations role has been eliminated. He's been moved to a non-operational advisory capacity pending review." He said it the way lawyers say things, carefully, technically, without editorializing. I took a breath. Here's the thing about 19 years. You don't do that work because it's glamorous. Nobody goes into pharmaceutical quality assurance for the recognition. You do it because you understand, at a level most people don't have to think about, that the drugs going into that IV line are going into a real person. A 67-year-old grandfather in a hospital bed in Dayton. A 9-year-old kid who just had surgery. Somebody's mother. Somebody's wife. They're trusting a system they can't see and don't understand to have been built carefully by people who cared enough to get it right. I cared enough to get it right. For 19 years, I cared enough. Being called overly conservative for that was the sentence that had sat in my chest since Thursday morning, heavier than I expected something so small to feel. Not because it hurt my pride, though it did, I won't pretend otherwise, but because it told me exactly what that building had become in the hands of someone who saw a $380 million contract and saw only the number, not the 43 hospitals, not the patients, not the people on the other end of the supply chain whose names nobody in that conference room had ever said out loud. I told Scott I needed a day. He said that was fine. They weren't going anywhere. I drove back out to the facility that evening, not to go in, just to sit in the parking lot for a few minutes. The lights were on inside. Through the windows of the production floor, I could see the silhouettes of people still working. The line technicians, the lab analysts, the people who actually made the thing run, who'd been there before Chad arrived and would be there after he was gone. Good people. Most of them, anyway. I thought about the color-coded sticker system I'd built. The batch record templates I'd redesigned after an FDA inspection in 2019 found a documentation gap. The training program I'd written for new QC analysts, the one that started with a single sentence on the first page. The patient doesn't know your name, but they are counting on you. I thought about my daughter calling me that Thursday night after Scott had told her what happened. She'd heard from her mother, who'd heard from me, and she'd said, "Dad, you did the right thing." And I'd said, "I know." And there was a silence on the line that felt like she was deciding whether to say the next thing, and then she said, "I know you know. I'm just saying it out loud because I think you need to hear it from someone else right now." She was right. I did need to hear it from someone else right now. She was right. I did need to hear it. I accepted Caldwell's offer on Tuesday morning. The terms Scott had negotiated were good. Better than I'd expected, honestly, though he told me later that the speed of their concession told us everything. They knew exactly how exposed they were, and they knew that I knew it too. That kind of leverage, used well, doesn't feel like victory. It just feels like the correct thing being confirmed. My first day back, I walked into the facility at 7 a.m. and went straight to the batch staging area. The orange sticker from Batch 7 Alpha's paperwork was gone. The correct documentation was in its place. Someone had done it right this time. The lead technician on the floor, a woman who'd been at Caldwell for 12 years and had worked under me for most of that time, looked up when I walked in. She didn't say anything. She just nodded, the kind of nod that contains a full conversation, and turned back to her work. I set my coffee down on the corner of the work cart. I opened my laptop. I pulled up the batch records queue and started from the top. The $380 million contract with Meridian was gone. That damage was real, and I don't minimize it. The company would spend the next 18 months in remediation, working through the FDA's corrective action requirements, rebuilding the documentation systems that had been quietly eroded. There would be legal costs. There would be a period where we operated under enhanced scrutiny, with quarterly FDA check-ins and every batch record subject to third-party review. None of that was painless. I'd be lying if I said otherwise. But Batch 7 Alpha never went to those 43 hospitals. That's the number I come back to when I think about that week. Not the $380 million. Not my separation agreement. Not the back pay. Not the remediation timeline. 43 hospitals, hundreds of patients over the course of that contract period who would have received a drug that had never been properly tested for sterility, who would have trusted the system the way patients trust the system, completely, invisibly, without any choice in the matter. They never knew how close it got. That's probably for the best. I still wake up before my alarm most mornings. I still go over checklists in my head before the coffee finishes brewing. My wife still says I treat the kitchen table like a second office, and she's still not wrong. Last month I hired a new junior QC analyst, a 26-year-old named Jasper who just finished his master's at Purdue and was so nervous on his first day that he asked me twice if he was reading the batch record template correctly. I handed him a copy of 21 CFR Part 211 and told him to keep it somewhere he'd see it every day. He asked me why. I said, because this is the document that stands between what we make and the people who need it. And those people don't know your name, but they are counting on you to know theirs. He looked at me for a second, this 26-year-old kid with his whole career in front of him, and he said, "Yes, sir," with a seriousness that I recognized. The same seriousness I'd had 22 years ago. Sitting at a different bench in a different lab holding a different piece of paper. Some things are worth being rigid about. The patient at the end of the line always has been one of them. I've thought a lot about what Philip said to me in that conference room, or more accurately, what he didn't say. He sat there for the entire meeting and wouldn't look at me once. 19 years of working alongside that man, and when it mattered, he studied the wall behind my shoulder like it contained the answers to questions nobody was asking. I don't say that to condemn him. I say it because I think it's the most honest illustration of what happens when people quietly trade their judgment for comfort. Philip knew. He knew the batch records were being rushed. He knew what a blank confirmatory test field meant. He knew me well enough to know I wouldn't have flagged that endotoxin screen without a real reason. And he sat there anyway, because the alternative, standing up in front of Chad and saying, "This is wrong," had a cost he wasn't willing to pay. That's not a character flaw unique to Philip. It's a choice that gets made in rooms like that one every single day by people who are otherwise decent. The cost of speaking is immediate and visible. The cost of staying silent is abstract, somewhere downstream, attached to someone you'll never meet. That math is easy to do wrong when you're sitting across from your boss's son and your mortgage is due in 2 weeks. What I keep coming back to is this. The reason any of it worked out, the reason Batch 7 Alpha never reached those hospitals, wasn't luck, and it wasn't some outside force stepping in to correct the situation. It was a sequence of choices made by specific people over years that created the conditions for the right outcome. Dr. Isabel Park handed me her card at a compliance conference in 2021 because she was the kind of person who believed that relationships between regulators and industry professionals should be real ones, not just formal. I kept that card because I was the kind of person who understood why she meant it. When Thursday morning came, those two choices, hers and mine made years apart, became the single most consequential phone call of my career. That's how it actually works, not in dramatic moments, in the accumulated weight of the small decisions that come before them. Chad made his own accumulation, 8 months of cutting corners, dismissing expertise, appointing himself the authority over systems he didn't understand, and surrounding himself with people like Finley who would confirm whatever he'd already decided. Each individual choice probably felt manageable in the moment, probably felt like efficiency. The $380 million contract felt like proof he was right. It wasn't proof of anything except the consequences have their own timeline, and they don't announce themselves in advance. I think about Jasper sometimes, this 26-year-old kid asking me twice if he was reading the batch record correctly on his first day. There's something in that nervousness that I recognize and genuinely respect. He didn't assume he knew. He checked. He asked. He understood, without anyone having to tell him, that the stakes of getting it wrong were not his career or his performance review. They were something larger than that, something that lived outside the building entirely. That's the thing I've tried to hold on to through all of it. The work isn't about being right. It's not about the separation agreement or the back pay, or watching Chad get moved to a title that means nothing. It's about the 43 hospitals that received a different shipment that quarter. It's about the grandfather in Dayton, and the kid recovering from surgery, and every other person at the end of a supply chain who trusted a system they couldn't see to have been built by someone who gave a damn. I gave a damn. For 19 years, I gave a damn. And when they told me that was the problem, I went home. I called my attorney, I made the right phone call, and I came back. That's all any of it ever was. Showing up, knowing what you know, not letting someone else's urgency become your compromise. Some things are worth being rigid about.